Welcome to Abaton.com, where we are addressing our knee PMS. I'm Dr. Abaton, I'm your physical therapist, and this is Mr. Abaton, a shadow of your future self. And we're going to be talking about the knee, and one of the best exercise to rule them all in our Rule Them All exercise series of how to strengthen and how to provide the most support for the knee. The knee is a really complex structure, even though it has just pretty much one motion that it moves. It has a little bit of a rotation, but pretty much just a bending and an extending. That's kind of the motion it gets through. The problem is when you put rotational forces in it, you get tears, like your ACL tear, and you get tears to the MCL and the LCL and the PCL and all these CLs that get torn up and ruined. But what we can do is we can strengthen it in such a way to involve our hip muscles up here and right down to the knee. So our hip helps control the knee because you have this big IT band, and you have your glute med, which straps down through the IT band into the outside of the knee here. And this gives a lot of lateral support. Now you also want to get your quad strong and your hamstring strong to also give that flexion extension support. Sports, especially women, are very vulnerable to ACL tears. This exercise we're going to show you will help prevent those ACL tears. If you can strengthen this here along with the knee in a really dynamic motion together, then you have the strength to be able to resist the rotational forces that you put in it when you're playing sports. Now, if you're just a normal Joe Blow guy who just wants to have a knee to stop hurting, this will also provide that because it gives the strength through the quad that gives a lot of support, and also through that hip, again, that gives lateral support so that you're not getting forces that are going through the joint, but rather through the muscle itself. All right, so let's jump into this here. So this is one of the best exercises. You need a step, but we're going to show you also with our chair how to do this. You can also do this on an actual stair in your house, which is awesome. So what you want to do is you're going to step up on the step. The knee that you're going to strengthen will be up on the step, okay? And you'll step close to the front of the stair, and then this is a down and back motion. Anytime we move backwards, it's better for the knee when we're going backwards. So if you're doing a lunge or something like that, if you're going forward past your toes, there's just a lot of compressive forces, and this can cause problems and injuries to the knee. So when we go backwards, this is totally different than a forward lunge. You're going to step backwards, and it's going to keep it a really nice angle and a really nice position to avoid pain and problems. So on this particular exercise, you're going to take a step down and back. You're going to let yourself move backwards off of that stair. Now, when you're doing this, you're going to activate your hip and you're doing this back motion. You want to make sure this knee stays nice and straight. Do not let it go in and out. And that's the hard part, and this is the beauty of this exercise, is when you're doing this motion, you want to be able to stabilize this knee so that it's not going in and out, even trying to push it out a little bit. So on a smaller step like this is a great beginning level. You're just stepping back. You're doing a really nice control of that knee. Keep it nice and straight, not letting it go in and out. And just a nice controlled step back. Now as you progress, you want to go to a higher surface because it's going to take more control. The more control, the better chance you have of protecting your knee and having a stronger knee. So we're going to advance to the chair. So when you start this exercise, you want to be holding on to something. Make sure that you're nice and steady and sure. As you progress and get stronger, you want to make it more of a dynamic stabilization type exercise. So you want to let go of things as you get stronger and better at this. So as you also go to a higher surface, you're going to be able to drop down lower. So you can drop way low. You want, on the lower step or the higher step, you want to try not to touch with this back leg. So you're doing this nice low step. I used to do this off park benches. Nothing to hold on to, and step way down, good control and balance. And the more balance you get, and the more control you get over this knee, the better you'll do. Mr. Abaton is a shadow of yourself now. So the more control you get over that knee, the better you'll do with being able to protect your knee, if that makes sense. You're going to be feeling it crazy through the quad, but also the surprise place to feel this, where most people don't guess, is up in this glute med, up in the hip. Up in the hip. You can't see it on this side. Up in the hip on this side. You're going to be feeling it through here. Not on this leg, but on this leg. So you're going to feel that through the hip, down through the quad. When you work things together, it's more functional. It's more real to how to move. And so this is really important to do together. This is our retro step. I love it. You're going this backwards motion. It's so good. It's working all the major components. Make sure you keep your knee nice and straight as you do this. Going down and back. Fantastic exercise. This is probably the best exercise you can do for your knee for getting strength, stabilization, and control, and protecting it as well as progressing your strength. Give this one a whirl. You will love it. Thank you for watching this video. Be sure to like and subscribe, and make sure that you leave in the comments below how you felt about this exercise. If you tried it, how did it go? And see if you can perform as well as Mr. Abaton here. Thank you, and we will see you on the next One Exercise to Rule Them All video. If you haven't seen the other ones, make sure you check them out in the link below. And we will see you on the next exercise.